This type of psychiatric drugs are all antipsychotics that are usable as a first-line treatment. The first antipsychotic was called Thorazine, and it was discovered by Henry Leroy in the 1950s. These drugs, also called neuroleptics, are the most dangerous types of drugs that shrinks use. Originally developed to treat schizophrenia, they are now used to treat a lot of things, and they are an improvement over things like lobotomies and insulin coma therapy for schizophrenics. All antipsychotics antagonize dopamine at the D2 receptors, some at other dopamine receptors as well. There are a few newer ones, like Abilify, that are technically partial agonists at the D2 receptors, but partial agonists partially activate but do not fully activate a receptor. But because they occupy receptors and compete with receptor agonists, they work as competitive antagonists. So all these drugs antagonize dopamine at the D2 receptors, trying to reduce dopamine activity by at least 65%. Many of them, especially the newer ones, work on other receptors as well. The problem is blocking dopamine is dangerous because dopamine is one of the most important neurotransmitters. Higher amounts of dopamine are associated with happiness and motivation. Furthermore, it's believed that Parkinson's disease is caused by a lack of dopamine production in the brain. This is why they can cause drug-induced Parkinsonianism. They can also cause extrapyramidal side effects like tardive dyskinesia, a syndrome that causes uncontrollable facial movements and is often permanent. Of the antipsychotics available in the United States, Haldol is the most likely to cause tardive dyskinesia. Drugs that can cause these problems are, by definition, neurotoxic. Drug companies later developed second generation, also called atypical antipsychotics. These are generally less likely to cause tardive dyskinesia, and the drug companies promoted these drugs as much safer and different from the old antipsychotics. As it turns out, they aren't much different from the old antipsychotics. Generally, they are less likely to cause extrapyramidal side effects, but more likely to cause weight gain, metabolic syndrome, cardiovascular disease, and diabetes. For these reasons, they can literally take years off your life. Although there was one meta-study that said that antipsychotics might shorten your life, but they don't shorten your life as much as schizophrenia, the data in this study was questioned quite a lot because they excluded 65% of the people who died from their data who were on antipsychotics simply because they died in the hospital. The longer you take them, the more likely you are to get complications like diabetes. Some, like Zyprexa, can easily cause you to gain 30 to 100 pounds. And a lot of people are put on these drugs lifelong to their detriment. My channel has a lot of unfashionable observations which can be controversial. Here's one of them. There are many misconceptions about schizophrenia